SolidAIRity Flex by Securison Medical, the new force in airway safety. The SolidAIRity Flex Oral Endotracheal Tube Stabilizer with patented interlock securement technology is designed to better secure the endotracheal tube and prevent clinically significant movement against increased forces. It accomplishes strong and reliable securement while allowing for easy and accurate depth and lateral adjustment and greater patient comfort. Here's how it works. After the patient is intubated and correct placement is confirmed by currently accepted standards of care, complete the stabilizer application process while maintaining the position of the endotracheal tube. Keep the ETT's numeric depth marker, that is at the level of the patient's upper incisors or other reference landmark, in a fixed position throughout the application process. For example, post-intubation position of the ETT at the level of the upper incisors is 22 centimeters. This position should be maintained while applying the stabilizer. The first step is to prepare the stabilizer for application. Remove stabilizer from its package. Check that stabilizer is intact and not damaged. Prepare the patient's skin. Before applying the stabilizer, the patient's skin should be clean, dry, and free of oily residue. Move the ETT to the left side of the patient's mouth and position the inflation line so that it will be out of the way during stabilizer application. Step 2 is to apply the stabilizer to the patient. Remove the release liners from the cheek pads. Pull on the cheek pads so they are out of the way and center the stabilizer shuttle over the patient's upper lip. Allow the upper lip foam to lightly touch the skin. Press the two cheek pads onto the patient's skin and hold in place until they are well adhered, approximately 30 seconds. Step 3. Secure the endotracheal tube to the stabilizer. Before applying the ETT to the stabilizer, make sure the tube surface is dry and free of residue. Clean the area of the tube to which the collar will be applied using an isopropyl alcohol IPA wipe. IPA wipe provided in package. Push the orange door release button and use the door wedge to simultaneously open the tower door and interlock collar door to the fully open position. Remove the door wedge and discard it. While maintaining the interlock collar within the tower, remove the two adhesive release liners. While firmly holding the ETT and maintaining the ETT's numeric depth marker at the level of the upper incisors, press the tube firmly against the adhesive to ensure full contact. While ensuring the inflation line does not get enclosed within the interlock collar or tower, close the interlock collar door until it latches completely. Close the tower door until it latches completely. You will hear an audible click as the door release button snaps back into the locked position. Pull on the door handle to ensure that the door is locked. Step 4. Apply the adjustable neck strap. Secure the neck strap by passing the loose end of the strap under the patient's neck and then up through the stabilizer's lower strap slot. Pull the strap upward and out, and then pull the strap downward and engage the hook and loop closure. If necessary, adjust the strap on both sides until secured. However, to minimize risk of skin injury, do not over-tighten. If the patient is going to be moved or any procedure performed that places the patient at increased risk for tube dislodgement, consider using a second strap for added securement. Step 5. Confirm appropriate depth position of the ETT. It is important to confirm appropriate depth position of the ETT both immediately before and after application of the stabilizer. Confirm proper position by listening to breath sounds bilaterally with the patient's neck in both the neutral and flexed positions. Confirm appropriate depth position of the ETT by obtaining a frontal chest X-ray with the patient's neck in the neutral position as soon as possible after completion of application of the stabilizer. Clinical judgment should guide any repositioning of the ETT. Routine care, depth repositioning. During routine care, monitor the depth of the ETT and maintain the ETT's numeric depth marker at the desired level of the upper incisors or other reference landmark and adjust as necessary. To reposition the depth of the ETT, deflate the balloon. Push the door release button and swing the door until it rests in the full open position. While holding the tower, disengage the interlock collar ribs from the tower recesses by pulling the ETT outward from the tower. Move the ETT until the desired numeric depth marker is opposite the upper incisors. Re-engage the interlock collar within the tower. Ensure a minimum of one interlock collar rib is always engaged within the recesses of the tower. Failure to engage at least one interlock collar rib within the tower is unstable and may lead to malpositioning, including unplanned extubation. Close the tower door until the door latches completely and the release button snaps locked. You will hear an audible click. Reinflate the balloon. Recheck breath sounds. Routine care. Oral and skin exams and lateral repositioning. Perform regular examinations of the oral tissue, lips, and facial tissue. If any irritation is noted, reposition the tube away from the irritation to minimize the risk of tissue ulceration. To reposition the ETT laterally, squeeze the tube shuttle tabs on the outer edges and move the ETT in either direction along the track to the desired position. Removal of the interlock collar from the endotracheal tube. The SolidAIRity oral endotracheal tube stabilizer is designed for adjustability 2 cm up or 2 cm down. If clinical findings suggest the ETT must be moved up or down more than 2 cm, the SolidAIRity interlock collar will need to be removed. In the rare instance where the clinician determines removal of the interlock collar is necessary, proceed with the following steps. One clinician should hold the ETT and maintain the tube's numeric depth marker opposite the upper incisors during the entire removal and reapplication process. One clinician should perform the interlock collar removal procedure. Push the door release button and open the tower door. While holding the tower, disengage the interlock collar from the tower. Remove S-flex from the patient and discard. Press firmly on the region of the interlock collar between the latches. Open the interlock collar door while disengaging the adhesive on the interlock door from the tube. Peel the tube away from the collar. Once the interlock collar is removed from the ETT, discard the interlock collar. Do not reuse. Replace with a new SolidAIRity Flex Oral Endotracheal Tube Stabilizer. Extubation. Removal of stabilizer. Extubation procedures should be performed according to currently accepted advanced airway standards and institutional protocols. To remove the stabilizer, push the door release button and open the tower door. While holding the tower, disengage the interlock collar from the tower. Release the neck strap by unfastening the hook and loop closures. Remove the cheek pads by gently peeling them away from the patient's skin. Remove the stabilizer. After use, handle and dispose of the device in accordance with institutional protocols and universal precautions for contaminated waste. This video is intended for instructional use only. Before using this product, review the instructions for use found on the product packaging or visit www.securasin.com/instructions. SolidAIRity Flex by Securasin Medical, the new force in airway safety.